The winter weather and freezing temperatures we saw last week are having an impact on the blood supply in the state.
Versiti Blood Center of Michigan is facing an emergency blood shortage. So here to talk with us right now, Dr. Dan Waxman. Thank you so much for joining us today, Doctor.
Thank you for having me on.
Well, first off, what is causing all of these shortages?
The weather really has been the challenge. Anytime that we are collecting donors, volunteer donors, each and every day, we count on them being able to get to where our mobile is going to be. And 20 to 30% of our donors are at either high schools or universities. So if those schools shut down for the day and they were having a blood mobile, then we aren't able to collect donors.
I'm curious how big of a crisis it is right now. How low is the supply?
Well, we've gotten down to about a one-day supply, and that we really don't want to get it so low that we're, each and every day we're just replenishing the bare minimum. We like to have at least 3 days of supply, both at our blood centers, at our locations, but also in the hospitals where the blood is needed. So we want to make sure that people can come out and donate. We're open 7 days a week. We have 10 different donor centers throughout the area. And then we also run a number of these blood mobiles where we go to the donors.
I was going to say some of those that were canceled or possibly could be rescheduled, but that doesn't help immediately, at least. Tell us a little bit about the impact that the lack of blood donations will have on treatments and surgeries in the hospital you mentioned.
Absolutely. Each day, 24 hours a day, blood is being used at our area hospitals. They can be used on an elective basis for a planned surgery or a planned transfusion, or it could be on an emergency basis where there unfortunately is an accident or an injury. And so the blood and blood products need to be in the hospitals ready to use when they need them. And if it isn't, then surgeries can be delayed, treatments can be delayed. The last thing we ever want, and which we haven't had, is that someone who needs blood immediately isn't able to get it.
What blood type is needed most right now?
Quite honestly, all of them. Now, blood group O is the universal blood type, and we can use blood group O, especially O negative, on any patient. But right now, no matter what your blood type is, we would like you to come in and donate. Blood is a renewable resource. We can't create it. It's not something I can make in a lab. It's something that we need someone to volunteer to do. The whole procedure from the minute you walk in and to the minute you walk out is about an hour. The actual donation, 10, 15 minutes at the max. So it really is something that you can do as a volunteer, and I guarantee you're going to save lives.
Yeah. And once again, you mentioned it briefly, but who can donate and how do they get to the donation site?
Sure. So in the great state of Michigan, you can donate as young as 16 with your parents' permission. There's no upper age limit. You have to be at least 110 pounds and be in good health. But people might say, well, I'm on a blood pressure medication, I can't donate. Well, no, you can. If you're on a blood pressure medication and it controls your blood pressure, you can be a donor. And if you're on different medications, you can. So all we ask is that you go to our website, versiti.org, and VERSITA.org, and see if you can donate. The number's up here in terms of the 866 number to call, and you can be a donor today and save lives tomorrow.
Fantastic. Okay, all that information is available on our website, woodtv.com. Dr. Dan Waxman, thank you so much for joining us. We appreciate it.
Thank you for having me. Appreciate it.